Hello, everyone. Thank you for joining us on the School Community Health Alliance of Michigan podcast. My name is Alex Frankfort. I'm the Communications Manager of SCHA-MI. Today, we have a special guest, Tagg, the manager of the Child and Adolescent Health Services Unit at the Michigan Department of Health and Human Services. Tagg, thank you for joining us.
Thank you. I appreciate it. I'm glad to be able to do this. Thank you, Rob.
You'd like to give us kind of a little background on what your role is at MDHHS and what you do?
Sure, yeah. So I'm currently the manager for the Child and Adolescent Health Services Unit at the state, and that's the unit that houses the health center program. So that includes the clinical sites, the school wellness program sites, and the E3 sites as well. I also manage the school-based hearings and vision screening programs that are in the schools.
So during your, tenure with MDHS and working with the network, what are some of your, kind of fondest memories and interactions of working with the health centers across the state?
Yeah, so I've been with the program about 15 years now in some kind of various roles. I started as a consultant with the program. In my previous work, I worked a lot more directly with the sites and everything. And there are so many great memories of this program. This is such a great program. It's so near and dear to many of our hearts that work on this. I think one of the things that when I look back, we collect all this data, right? This is a very important part of our program, our data to justify kind of what we've done and things and what's going on in the sites. But the stuff that really sticks with me are the narrative stories that we get. So we'll get narrative stories generally every year. And some of them are so profound. Like one that sticks with me from years ago is a site that a student athlete came in. I think he was getting a physical for football, and he was 15, 16 years old and had no health problems. And during his physical, they noticed something going on with his heart, and it seemed serious. He immediately got referred. I think it was within a week, he was having surgery on his heart to correct this defect, and it was a life-threatening defect. And for whatever reason, it had not been diagnosed up until that point, and it was diagnosed in one of our centers. And it just made me think, things like that is just really kind of nails home the importance of the centers and the importance of this adolescent-focused care where they can, take time and really kind of evaluate all the health aspects of our teens.
Absolutely. Yeah, that's amazing. Really without the health center, who knows when that really would have reared its head for that.
Yeah, exactly. Right. Yep. Yeah.
I mean, there's a million stories like that. We hear about them all the time. So
there are, yes, there certainly are. Yeah. And when those stories come in, those are so powerful and impactful on us because, it's great to see the data, and it's one thing to see the data, but when you can see these personalized stories, that just really shows the impact.
Yeah, what really hits home. We found that, when we're talking with legislators or we're taking them on tours of the centers, that's always what makes the most impact, is that for those firsthand experiences and stories they hear from the kids, whether we're in person or we're sharing them with them, digitally in some way. That is always, 10 times out of 10 what really, converts them into being a big, supporter and advocate for them. So that's great.
Yeah, definitely. Yeah, sure.
So moving forward and kind of turning towards the present, obviously we've had a lot going on with the pandemic, and 2020 was just a roller coaster for everyone. But what is the current state of the network right now in Michigan as you guys see it?
Yep. It definitely has been a bumpy time this past year, as everyone knows. We were very fortunate that, there were no cuts this year to our program. There was a while where we were worried that there may be cuts, but there weren't. We actually got an increase in our E3 program, our mental health program. So right now, we have one of the largest programs in the country. I'm not sure exactly where we are right now. At one point, we were 2 or 3 as far as state funding coming through. But we have around 170 programs now, which is great. I think when I started 15 years ago, we were somewhere in the 30 range or something like that. So it's been a consistent, increase over time. The majority right now of those sites are our clinical sites. We have 86 or so clinical, around 68 or so are new mental health sites. And then the rest are SWP and some nurse only sites we have. But I feel like, you know, when something like this happens and we have to kind of mobilize as a field, like the field has really done around this pandemic, it really, you know, it helps to strengthen our program so much. And, you know, as all of you at the sites have played a role in the pandemic, a role beyond the centers, a lot of you have, beyond our adolescent care that we typically provide. And I feel like that just strengthens our program over time. And, you know, I feel like as far as like the strength of our program, I feel like we've never been stronger. This is the biggest our program has been. And we really feel like we're serving those youth that are in need.
Absolutely. Yeah. We find on, you know, some of the coordinators calls or, you know, network calls, the weekly stuff that we do, people are really leaning on each other more as a network. And it's really amazing to see that strength and that, you know, camaraderie to help get, you know, the kids through this and everything.
Yeah.
So that being said, does MDHHS, you know, is there any thoughts or guidelines on or advice that we have for centers for moving forward in the pandemic? Do we see any unique role or ability for the centers, you know, as the COVID vaccine rolls out? And we don't know what that's going to look like. We don't know how involved they're going to allow centers to be at this point, you know, in early February.
Yeah.
What do you guys feel like the recommendation should be on centers of how they can help their community, how they can educate their community on the vaccine and just get the best outcome for everyone?
Yep. Yep. I wish I had a nice, tidy answer for that, but I don't.
Oh,
I can tell you my thoughts on it. Right. So definitely this is a crazy unique time. And unfortunately, a lot of the information and guidance and stuff like that is kind of being built as we go, you know, at the state level. I'm not just talking about our program, but at the state level, trying to figure out the testing rollout and now the vaccine rollout and all that sort of stuff. So I feel like, you know, we've been able to provide some flexibility with the health center funding and allowing during the times when schools are closed and during the kind of heat of all this, that health center funding could be used to fund some COVID efforts. So I know many staff in the centers served as some, you know, filled in some holes for COVID efforts, even if it was outside of our population for a while. But moving forward with the vaccine, it's something we're working with our immunizations area on. You know, they're providing the kind of the guidance on this, and then our job then is to roll this out to how it would specifically affect our centers. You know, the main issue I think right now is just the timing of the vaccine and the ages that it's approved for. So the majority of our population couldn't get it yet, and it's not approved yet for the majority of our population, but we're hoping soon that with more vaccines coming out and more research that it will be that lower age will be decreased, so more of our sites can be vaccinated. So I think it's like kind of a two-step thing. One is we're seeing the future down the road when if the COVID vaccine is something that's a yearly thing or that's a routine thing, that it would be just like getting a flu shot. So anyone could come into a center and get it just like the other shots. But temporarily, we're trying to figure out, and we're working with sites and we're working with our IMS area to figure out, you know, what is our role in vaccinating teachers and staff and in vaccinating, you know, high-risk people in the school and things like that. And a lot of it might be that it's not the center's responsibility to do that, but the center can be involved in that and advise in that because these are medical professionals. So certainly being a part of that team. So we're really encouraging each site to kind of look at their unique role in this. And we're going to have a lot more kind of coming out about it. And our clinical team is working on this as well, but really trying to figure out at each site, what's the unique role and what value can they bring to the school.
Yeah. You know, from our perspective, when we talk to folks, they're so ingratiated in their community that a lot of times even just, you know, they've got parents and families reaching out asking, you know, any concerns over safety and, you know, the viability and how does this vaccine get pushed through so quickly? Did they cut corners? Questions like that.
Sure.
Our health center folks, our staff, they're such a trusted resource in their communities that they really can speak to what's happening, why the viability is there of the vaccine, why it's safe, and be a trusted source of information. So
yes,
we want to do all we can to support them in that. And again, it's a mobile situation. It's now, so we're all working our best to.
Yep. And one of the things too we've tried to do is to not inundate the sites with a ton of information. I mean, there's so much out there. I know, the providers in these sites are getting so many emails from their fiduciaries, from CDC, from everything, saying what to do. So we want to try to limit our messages and condense them as much as possible. But yeah, we're definitely a resource. So if these sites have questions about how they can better navigate this, reach out and let us know.
Absolutely. Perfect. I'm sure a lot of people are glad to hear that.
Yeah.
So the next thing I want to touch on with you and talk to you about, something that, it's kind of coming up now and we're all realizing, okay, we had to focus on the medical side of the pandemic for so long because it was such a grave importance, but now we're starting to turn our heads and go, okay, wait, what's the mental health outcome of this pandemic, especially on our students, who've been in isolation for basically about a year's time. We're starting to see cases of depression and anxiety on the rise related directly to the pandemic. What are you guys seeing as the, these prolonged kind of consequences and outcomes that have affected student mental health?
Yeah, I think that's a huge thing. I think that's something that we're seeing. And I know nationally, like we're seeing this in different data sets and things. But mental health, it seems to be, especially for adolescents, it's becoming a major issue. I will say that even before COVID and before the pandemic, I've always felt like this is something that has been so unique to our program and to the health centers, in that the story that I always tell, which told this 100 times before, so is that what we would always hear going out to site reviews and talking to providers is a kid would come down to a health center for their first time maybe, and they have a stomach ache, and they get sent back to class or whatever. Maybe next week they come down, they have a headache. Maybe the third time they come down, they disclose that their parents are getting divorced. They broke up with their boyfriend or girlfriend or whatever it is. And it's the kind of the process of going down to the center and developing a relationship and being able to open up. And oftentimes this is what we're hearing, is that a lot of things that a lot of issues that people come in with are really kind of can be addressed on underlying mental health issues. And that's why it's so important for our centers to have the medical and mental health together, so you can have this integrated care, this warm handoff. It's so important. But getting back to COVID especially, the isolation, the anxiety, just not knowing what's going to happen, not knowing if your school's going to be open or not knowing if, every time you go out, you can contract this virus. So it's definitely just taken a big toll. And we're very happy to have this expansion of our mental health sites during this time. This is great. So we're adding another 24, 25 sites to our mental health, our E3 program, which is already at 68, I think, right now. And so that's so critical. And I think that a big part of it too is just, our sites are adolescent focused. And so for a teen to go into a normal pediatrician's office or something like that, I feel like they're getting a slightly different kind of care when they walk into one of our health centers, because it is only adolescent focused. Or some of them are target younger kids too, but the majority are adolescent, and they really can talk to those specific needs that those adolescents have. One other thing I want to say about this too is when we talk about these mental health issues, we're talking about the students, but I also want to recognize the mental health issues of the staff that are in the centers, because this is a trying time for all of us. And for those of you staff that are in centers, hats off to all of you. You are right on the front lines. You're seeing this stuff. Many of you have put your own health at risk over this past year or so, and seeing patients amidst all this COVID stuff. And I know it's very stressful. And I think just for everyone, it's a time to just kind of reflect and say, this is a lot, this is anxiety producing. But for those of you, I just want to thank you for all your providers, the physical and mental health providers, and everyone in the sites that's continuing to do this work.
Yeah, absolutely. Yeah, I mean, like we've touched on a couple of times today, a lot of us in the network and everything, it's just kind of been a year of bracing and getting ready for whatever's the next thing that's coming at us.
Right.
Down the pipe.
Not recommending.
Right. So what, let's talk about looking forward and, into 2021. What do we want to set as goals for ourselves as a network, in 2021? It's obviously, it's difficult to try and look past just dealing with the pandemic.
Yeah.
And certainly that's a part of our goal, is overcoming that. What should we be looking forward to? What should we be striving for, in the next year as a network to accomplish?
Sure. I feel like some of this, when I talk about kind of this stuff, is focusing on next school year, almost, so that 21-22 school year, because it feels like this spring and summer is going to be a lot of dealing with the vaccine and trying to get that out and things, and continuing, I feel like continuing this kind of rapid pace of just information coming out and everyone trying to react as much as possible. But hopefully next school year things will return to normal. That's what we're hoping for. And that we can have a normal start to school, and that kids can be in school. I feel like the related to this, the goals are going to be, probably number one, dealing with the vaccine and how we can get that to kids. And hopefully at that point it'll be available. How our sites can do that, if they're doing it directly or if they're working with partners, if they're working with the school. I think that's an important thing. And then also, I feel like after once we're back to somewhat normal life, I figured that there's going to be some adaptations that need to be made for our centers and for everybody. Things are not going to return to the way it was before necessarily. So things like, COVID restrictions and continued testing and screening, stuff will probably still be going on. So I think it's important for, at a center level, for the centers to think about, once you are returning to in-service care full-time, and once things have settled down a bit, what is that going to look like? What sort of additional, restrictions or barriers or things like that you have to have in your own health center, but then also taking that out to the full school, and how you can be that resource for the school without having that take up all the time from the clinic, but being a resource to the school, because they, the centers are highly trained health professionals that can help in planning, can help in kind of determining how some of this stuff is rolled out. So I feel like those are like for next fall, like assuming everything starts as normal and things. That may be a big assumption, but I'm assuming so. I think those are the big things that we'll be looking at.
Right. Yeah.
And also, just amidst all this too, just returning to our normal care. So returning to the normal, very important things that you all are doing in the health centers in helping our adolescents.
Absolutely. Yeah. Well, thank you again, Tagg, for joining us. I don't have more questions for you today, but any final kind of words of encouragement for the network you want to say?
I just want to thank you all. I mean, it's, it really, it's this program continues to grow, and, because of the advocacy efforts by SCHA-MI, and also all the data and all the work that's put in from the sites. I know At the state, we require a lot of reports and a lot of data to be reported. I know that can be a pain, but all that does pay off, and we have great support. We can show these great outcomes for our program. So I just want to thank all of you, because, we can say we've got one of the biggest programs in the country and all this stuff, but if you weren't at the sites doing this work, we would not have this program. So it's your work that's really driving all this. So I just want to thank all of you for that. And also thanks to SCHA-MI for all your advocacy efforts over the years.
Thank you. We appreciate it. Yeah. So thank you again for joining us, Tagg. We want to thank everyone for watching and listening here today with us. This concludes another episode of the SCHA-MI podcast. Thanks for listening, and happy School-Based Healthcare Month. Thanks, everyone.